I would prefer not to have to yell for 2 hours. Because I don't have to teach class and I'm working all day without a break. So if you guys could come up so I don't have to yell as much, I would really appreciate it. Are you gonna broadcast it?
Yes. Right.
It's already been.
We're on.
So just to let you all know, Chris has chosen to broadcast this live, so be mindful if you do share about an experience that you have, not to share any identifying information of any people that I know we all work for the same organization, so we can share with each other that information, but there's other people watching that one. We have to be careful.
Facebook is.
And it looks like you're just showing the screen, right?
Uh-huh.
Okay, so none of us are on video, so you guys know. And always want to ask for consent and let you all know. So is everybody okay with that? Nobody's on video.
Are you guys okay?
Any objections? All right, well, thank you all for being here. We've given this presentation before. I say we because it was created in collaboration with members of the El Paso Harm Reduction Alliance. The mission of the Alliance is to help provide education on the principles and intervention of harm reduction. We do presentations on xylazine, wound care, harm reduction principles. What else do we have? Presentations on
Safety.
outreach safety, this one. So yeah, this is all about how to conduct outreach for harm reduction in a way that is safe, that honors the principles of harm reduction. And we're also going to talk a little bit about self-care because outreach work can be very taxing physically and emotionally. So yeah, thank you all for being here again. So I wanted to give credit to the individuals that helped create this training. Jimena Diaz is now with the Texas Harm Reduction Alliance. They were a chair of the El Paso Harm Reduction Alliance, and they helped with the section on what I usually know is called. They did. I'll let you know when we get to the section. It's not quite coming to me yet. I'm sorry. I had a kind of a difficult morning. And then me, I did the section on de-escalation. Chris did the one on outreach safety. Johanna did the section self-care. Maricela did the section on the outreach kits. Paul did the section on what is outreach. And then Christine did the section on how to prepare. Maricela, Johanna, and Paul are with the Recovery Alliance of El Paso. They work at the drop-in centers. Maricela is the program coordinator for the Naloxone Regional Distribution Hub. And then Christine is a program coordinator for Recovery, which is a statewide agency that does a lot of advocacy and workforce development. Just wanted to thank them for their contribution to this presentation. So today we're going to talk about what outreach is, populations that we serve, that was Jimena's section, ways that we can prepare ourselves to conduct outreach, what we did before, different items that we put in our kits, how to conduct outreach safely, some de-escalation strategies for if we encounter individuals that are emotionally dysregulated or escalated in the field, and then how to take care of ourselves. Just to get an idea, I know some of y'all, like Tobias, are like outreach pros. Is it okay if I say your names during the training? Yeah. Is anyone in the witness protection program? Tell me what your code is. Okay. So has anyone done outreach out in the street with individuals experiencing homelessness or people that like do sex work less than 10 times? Okay. More than 10 times. Y'all are, hopefully this is a refresher then for a lot of people, but maybe for those listening out in the virtual world of illicit. Okay. So what is outreach? Harm reduction outreach is a set of strategies and interventions, just like harm reduction, aimed at reducing the negative consequences associated with certain behaviors, particularly in marginalized populations. It involves engaging with people who are involved with high-risk situations like substance use, sex work, people who are experiencing homelessness, and providing them with support, education, and resources to minimize harm to their health and well-being. Is to get out onto the front lines to serve and to bring help to those in our community who are experiencing homelessness, substance use, and many times also mental health, and sometimes even a combination of all of these. The importance of outreach cannot be overstated because it involves getting out onto the front lines, being boots on the ground, and filling in the gaps regarding services that many overlook or are not even aware of. We go out into the street and we connect and engage with those who have literally been ostracized from society and feel that effect. We promote awareness on resources available in our community, like mental health, physical health, housing, harm reduction. We provide harm reduction kits, things like hygiene, safe sex kits, menstrual hygiene, as well as food and water. And these are just some of the aspects that entail outreach work. So we might go into camps where people who are on house stay, parts of town deemed dangerous through stigma and ignorance. We all know what those parts of town are here in El Paso, right? When we do that work, as most of us can attest to, when we've gone and done outreach, we're met with a lot of gratitude, right? People are really happy to get a meal, to get some items, for the most part, right? So many people, if you've been a person that has experienced homelessness, I have, you know that when you're out there, you're invisible. They don't look at you. They don't want you around, right? Just your very existence will become criminalized. And so having somebody go out, meet you where you are, treat you with some kindness and give you supplies, that is really important. So what we do is we bridge the gap between those communities and society at large in the hopes that with some attention and care, these people can these people can begin their journeys of recovery, whatever that looks like for them, and reacclimate themselves to having the basic necessities of a normal life, having shelter, food, and means of income. And I know many of us have also experienced meeting somebody during outreach. I remember this one gentleman I met living in the tent, and I watched him, engage in recovery, life, reconnect with his family, and do really well. Often, right, and sometimes reaches that first introduction that people, a series of people, made an. By the way, this protection. I'll leave it here. Nobody's on video.
Sorry about
Are you
that.
guys okay?
You good? Sorry about that.
Anyway, so yes, it's very powerful, and recovery and finding your way out of homelessness is possible, right? And outreach is an important component of that. Okay, so what are the goals of harm reduction? First is to minimize health risks. On the next slide.
Oh, I'm sorry. There we go.
So just like with harm reduction in general, right, one of the main goals is to minimize risk. So the primary goal of harm reduction outreach is to reduce the immediate and long-term health risks associated with risky behaviors. This can include providing syringes and needles to reduce the transmission of bloodborne infections among people who inject drugs, or distributing condoms to prevent the spread of sexually transmitted infections. Number two.
Okay.
Number two is to prevent overdoses and deaths. Harm reduction outreach often involves the distribution and training on the use of naloxone So for a long time, ECHO was doing a lot of the training for like overdose prevention. And there was a few times where Amanda and I would go out into the street and do trainings in the street. We did one at like Corner Pulse, for example. So, you know, educating people on how to reverse overdoses, making sure they have access to naloxone, which we all know is a medication that reverses opioid overdoses. By making naloxone readily available and educating individuals and their peers on overdose prevention, our harm reduction outreach aims to prevent fatal outcomes. And then finally, there's a few more. We promote education and awareness on safer practices, including safer drug use, vein care, sexual health, safer injecting techniques. By sharing evidence-based knowledge, harm reduction aims to empower individuals to make informed decisions about their health and well-being. For example, I'll put what is the safest place to inject if you're going to inject drugs?
Hmm.
Yeah, Lenny, Lenny, point on yourself here, on your arm. Yes, the arm. Anywhere on the arm is the safest place. Where is the most dangerous place to inject drugs? The neck. Yeah, the neck. There's a lot of arteries that supply blood to the brain. So those are the kinds of like education that we should foster trust in relationships. So by consistently going out and forming relationships, I'm sure those of us that do outreach on a regular basis, you start kind of saying the same people, right? They start recognizing you. You start building those relationships, trusting relationships with marginalized people. By engaging with people in a non-judgmental and compassionate manner, we help build rapport, gain their trust, insight, and then most importantly, we start to get information and insight about the challenges faced in the community so that we can be more responsive about what is it that people really need, right? Passing out songs and stuff. We start to hear like, what are the needs? What do people always ask for? Tents, right? If people want tents, they want sleeping bags. So we can start to tailor our harm reduction to the needs of the people restricting. The sounds of laughter. So that's good. Okay, and then we reduce social stigma and discrimination. So harm reduction outreach challenges stigmatizing attitude and discriminatory practices that often prevent marginalized people from accessing essential services. We advocate for the rights and dignity of individuals who engage in high-risk behaviors. Harm reduction promotes social inclusion and equality. I was fortunate enough this year, and Ray did it previously, to do some legislative visits in Austin, specifically like advocating for the rights of people, especially people experiencing homelessness, because it has become very criminalized in Texas. Luckily in El Paso, there's a lot of collaboration among outreach teams to get shelters and not to have to arrest people just for that's not a crime. And yet people are getting arrested for that. And finally, to facilitate access to support services. So harm reduction outreach workers serve as a bridge to other support services like healthcare, addiction treatment, recovery support, mental health services, housing assistance, and social support programs. We go out to the community and let people know about what's available. We can provide referrals and connect individuals with the resources they need. There's been times we've been out doing outreach and somebody says that they want help, maybe they want to go to detox, we make calls, or they want to come into a residential recovery center like that's what we done. On the spot, we can call and start getting the ball rolling. So overall, harm reduction outreach aims to improve the health, safety, and quality of life for people who engage in high-risk behaviors, which is really all of us engage in high-risk behavior, right? However, the access to services is very different. People, we respect people, and we meet them where they are without judgment. We recognize that reducing harm is a more practical and achievable goal than demanding immediate behavior change, and it serves as a crucial approach to public health and social justice. So what we encounter on outreach. Coordinated street outreach that identifies and engages people living in unsheltered locations like cars, parks, abandoned buildings, encampments, street plays a critical role within systems for ending homelessness. Here in El Paso, like I mentioned, we have a very strong collaborative community in terms of services to individuals experiencing homelessness. So there's an email list where the El Paso Homeless now, reports that they've received of individuals homelessness, and the outreach teams can be deployed out to provide them with services to offer shelter. So that is one way that we identify like serve. Effective street outreach reaches people who might not otherwise seek assistance or come to the attention of the homelessness service system, and ensures that people's basic needs are met while supporting them along their pathway towards housing stability. So why would people experiencing homelessness sometimes not otherwise seek assistance? Or no? Yes.
Some of the reasons might be because they had such shelters, they don't want to be like like.
Yeah.
So I think it's safer.
Very, very true. Ray mentioned that sometimes people might have had traumatic experiences at shelters and they might not want to utilize shelter services. That's, I've heard a lot. Tobias?
They might have warrants or be afraid they have arrest warrants and they don't want to encounter law enforcement.
Yeah, especially in a community like El Paso that is very militarized, right? Where if we have active warrants, maybe our documentation status, we might not want to go to organizations. Yes.
Yeah, they might be scared because they're undocumented. They just don't know.
Yes. We even going to a hospital, right, as an undocumented person puts you at risk. Other reasons I've heard is, when you're experiencing homelessness, everything you have, you're probably carrying with you, right? A lot of times it's your job. Can I go to a clinic with my shopping cart? Are they gonna bring my shopping cart in? A lot of times people who are experiencing homelessness might have a dog with them that, it's a companion, but also protection. Am I gonna be able to bring my dog in? How are people gonna treat me if I come and I haven't had a shower? Not bathing is also something that people do to protect themselves. Especially women, right? So all of these reasons, thank you for sharing your insights. So again, look, we're gonna meet people who are living in unsheltered locations, people that use drugs, people that are experiencing homelessness, sex workers, people at risk of overdose, people with infectious diseases, and people who might not otherwise reach the system. So where and who? We go to areas with high overdose rates, and we're using that Atlas software, right? Where the outreach workers and peer supports are putting in that data of where people are experiencing overdoses, so we can see what areas of town are most impacted by overdoses, and we can target our outreach efforts to those areas. We go to areas where illicit drugs are prevalent, which is really like everywhere, right? Every neighborhood. Go to shelters, encampments, bus terminals. Chris and I trained the Sun Metro security drivers and bus security guards, and bus drivers, and many of them shared their experience of they had reversed 6 or 7 overdoses. Strip clubs specifically for between outreach with sex workers, adult entertainment stores, bars in our own backyards. We also go to hotels and motels where we know that sex workers are performing their work, or where people are using drugs. We also do outreach to people who can't be reached by telephone or mail. We can also do it with people that we serve, or even with each other, right? Hey, I haven't seen or heard from Jamie in a while. Let's go chat on her. That's outreach. People who prefer to meet in their preferred location, like the park, right? Some people feel more comfortable there, but people who are homebound. Thank you. Alright, so steps to conduct before, steps to take before conducting outreach. Hydrating, resting, planning, preparing, and communicating. I'll go through these in depth. Also wanted to mention clothing. Please don't show up for outreach in flip flops, right? There's a good chance that you'll have to go into an arroyo or out in the desert, so make sure you're wearing closed-toed shoes. I always take off all my jewelry, baseball cap, jeans, t-shirt,
Sunscreen.
sunscreen. I always, if you've done outreach with me, you already know what's the first thing I ask.
Yeah.
Did you put on sunscreen?
Yeah.
Put on sunscreen.
She makes me do it.
Yeah. Yeah, before he leaves the house,
Because if it weren't for her, I'd look like a California raisin. I'm already on my.
so if you're taking certain medications like SSRIs, normal eat, so make sure you're drinking. Okay. All right, so the first thing you want to do is prepare outreach materials. This can be pamphlets that you're going to pass out to people, handouts that provide relevant information about harm reduction, the services available. Make sure that those materials are culturally appropriate and easy to understand. In our community, bilingual, right? Want to make sure we have English and Spanish. Something that I like to do is try to identify like where we're going to go ahead of time, just so we have some like target locations, and we'll talk about internet safety. A local resource guide here in El Paso, OSAR, keeps a really good resource guide. If you ever go online, if you need it, let me know, I can send it to you. But they have like a very comprehensive resource guide broken up into sections. It would kind of be a lot to print out, but maybe, you know, somebody would donate it to us so we can print out like 10 or 15 to take with us. Develop a referral network. We all know, a lot of us here not only are outreach workers, but we're peer supports. We are resource brokers, right? At Project Vida, we started a little like resource tab. I don't even know what to call it. It's like a virtual shared workspace, and we dropped in a bunch of resources. I know Claudia has resources that and Elena has some that I don't know about. Together, we're a wealth of information. So make sure that you're developing those connections with healthcare providers, treatment centers, counseling services, social support organizations. I mean, you name it, right? Because the needs are great. I'm gonna say something. Oh, I think that's why participating in the Ross, sorry, I'll throw it's a place to network and learn about other organizations. One of the best resources I have, Mary shared with me, which is the First Baptist Church. If you all don't know about our First Baptist Church, they do amazing work and they help with so many things.
Yeah.
The other thing is ensuring confidentiality. Developing protocols to protect the privacy and confidentiality of people that we engage with during outreach. So I know, for example, like Punto de Partida, they collect data, but they don't collect names, right? It's all anonymized, especially because of the nature of the work, the population that we're serving that's very marginalized. We want to make sure that we're not putting people at risk. We want to respect the rights of the people that we're serving and maintain their trust. If we are recording, make sure to bring consent forms so that we provide for release. If required, obtain permissions or permits from relevant authorities or property owners to conduct outreach activities in specific locations. There's been times that I've ended up in lots that I didn't know were owned by like the rescue mission, for example, or EP Cares used to do outreach with sex workers, like in strip clubs. So you want to make sure to tell the strip club owners, because they'll know, right? We don't look like the usual hotel going in with our little backpacks and our baseball caps and our Narcan, right? You want to make sure that you're asking. So if I'm going to a hotel, I'll usually hit up the front desk first and say, hey, is it okay if I pass these things out? And actually what I've started to do is just ask them like, hey, do you know if there's anybody here that's using drugs or doing sex work? And they'll tell me what rooms. Go to this room, go to that room. And then I can just come and go to the rooms that they told me. Any questions? So before you conduct research, familiarize yourself with the concept of harm reduction and its principles. Harm reduction has a very robust set of principles that guide the work. So make sure that you're familiar with those. SAMHSA, a few years ago released a framework for harm reduction that's very comprehensive and a really good resource. I highly encourage you all to read it. So understand the specific issues and challenges faced by the target population that you intend to reach. So, for example, the criminalization of different laws that affect people that use drugs, the Good Samaritan law, the fentanyl testing strips, things like that. Make sure you're aware. Learn about your local laws and regulations, understanding the legal framework surrounding harm reduction practices in your area. This will help ensure compliance and avoid any potential issues. So, for example, many people, including policymakers, don't know that fentanyl testing strips are still considered paraphernalia, right? So make sure you're aware also that, like, passing out syringes in the state of Texas is also potentially not legal. So make sure you're aware of these laws to avoid any potential legal issues. You want to identify your target population, the specific group or community that you want to reach out to. Is it people that are using drugs? Is it sex workers? Is it people who are experiencing homelessness or any other marginalized population that could benefit from harm reduction services? Establish partnerships with your local organizations, community leaders, and healthcare providers who already work with that target population. This helps you to build trust, access resources, and maximize your impact. We like to do outreach with other organizations. It's very rare that it'll just be like Project Vida going out. We usually go with Recovery Alliance, the Public Health Department, the VA, different organizations. It's helpful because we're sharing resources with each other. Yes.
Didn't EFRA train the public health department?
Yes, we did.
Yeah.
You were, and Christine.
Yeah.
Me and Christine trained, we trained them in outreach. I think we did this presentation though. Develop a clear objective. So what are your goals and objectives for that outreach? Is it providing harm reduction education? Is it distributing supplies like syringes or condoms? Is it offering testing for infections or referring individuals to relevant support services? There have been times that we have drug testing kits available. So sometimes our goals have been like, you know what, there's a lot of overdoses going on, trying to figure out what that is, maybe getting a sample to test in the lab. So before conducting outreach, you want to plan your logistics on your date, location for your outreach. Consider things like accessibility, safety, and privacy concerns. Choosing locations and making sure to consider travel time and how the location will be accessed. Like I mentioned, I like to kind of use the El Paso Homeless Coalition's emails to help kind of guide our outreach. They'll give good information about like encampments. There's also areas that you're almost guaranteed to find people. And then I always like to ask also like other outreach teams where they've seen encampments. Number 2 is designate a note taker, someone that's going to write down the location in advance of the outreach experience and make sure that they have something to write with, location, date, and time, how many people were encountered, including any other relevant data that you might want to gather from the people who you are serving in outreach. Be sure to document everything. If there's no record of it, it didn't happen, right? Record keeping will be key in evaluating your outcomes. Decide on a safe word in case anyone may want to leave. Our safe word is usually the delivery has arrived. That's not a word, it's more like a phrase, but something innocuous. You're not going to say like cherry pie. I don't know. So yeah, like just like a cue to your team members that, you know what, whether it's like a safety issue or something. Prepare and provide a map to the team. Decide on a start and finish time And make sure to check it after, include a plan to debrief. So we always come back to home base where we started and debrief with one another. We usually break up into like 3 or 4 teams, so each team will debrief on how it went. Debriefing is something that is used a lot in crisis intervention. It's a protective factor against developing symptoms of trauma. And who has encountered something traumatic in outreach? Yes, right.
Yeah.
And you see sometimes difficult things, so comes back together with God and sharing and receiving support can really help prevent any kind of residual like stress response. It's important. And you can also talk about like what went well, you know, what could have gone better, and then any plans for the future. Okay, so next slide, please. The day before, make sure you're taking care of yourself. Self-care is preventative, like we'll talk about here soon. Get rest, stay hydrated, wear safe footwear, comfortable clothing, and sunscreen if you're gonna be outside. Assemble your outreach supplies. So what we usually do is, I think probably at the drop-in centers, you guys have all your stuff already in bags. At least that's how I imagine, like walking into a closet and all this stuff to all your stuff. Maybe it's not like that, but our stuff is in boxes just piled up to the ceiling. So what we like literally boxes piled up to the ceiling. So we usually will come together as a team, like one floor, and we'll have like a little pizza vibration. There's pizza, you know. We'll usually play some music and it's like adult trick or treating. We'll make our little bags. We usually decide how many bags we're gonna make, so make sure your stuff is in your outreach supplies. Things like condoms, harm reduction kits, drinking water. Christine is always so, and Regina's helps too. So great. Food is a great way to build rapport. You know, usually that's what I do is I'll just say, hey, do you want a burrito? And like it's a good way to introduce yourself. Hey, you want a burrito? Start introducing. Yeah, you can. Sure. Ask questions if you don't know what to do. Consider safety protocols for opioid overdose reversals and test diseases. Making sure to communicate with your team at home.